Everyone, and thank you for attending Chicago Commons Town Hall on COVID-19 vaccine called This Is Our Shot. My name is Edgar Ramirez. I'm the president and CEO of Chicago Commons. I'll be serving as tonight's moderator. Chicago Commons is a 126-year-old organization providing critical services to children, families, and older adults throughout the Chicago metropolitan region. We are hosting forums like this to provide our communities the latest guidance and advice on the COVID-19 vaccine. While tonight's program will be tailored towards older adults and caregivers, we think there will be something for everyone. Before we get started, I want to take a moment to acknowledge critical people and institutions who helped make tonight possible. Thank you to SEIU, represented by Jacqueline Rodriguez. Thank you to Illinois Association for Community Care, Home Care Providers, represented by Sarah Ratcliffe, for supporting this program. Thank you tonight to our board of directors who have joined us tonight. Lastly, thank you to the Chicago Commons team, especially our senior care division, Eliza Russell, Oli Soto, Carrie Crawford, and many others on this call. Thank you for your heroic work throughout this pandemic. The COVID-19 pandemic has significantly impacted our city and state. The health, social, and economic toll has been devastating. Equally, there's no doubt that the COVID-19 pandemic has disproportionately impacted our Black and Brown communities, especially our older adults, in ways that highlight the deep disparities and structural inequities that exist. That said, we see the light at the end of the tunnel. In the last 4 months, federal health officials approved 3 vaccines, which can reduce the negative impact of the COVID-19 virus and put us on a pathway to normalcy. Vaccine supply is increasing locally and nationally, and our public health officials have promoted equitable distribution and access to these vaccines. For some, this provides hope. For others, this provides several questions and concerns, especially given the unfortunate history of Black and Brown communities being preyed upon with harmful experiments or actions without individual consent or proactive education. We hear you. The purpose of tonight is to provide education on the vaccines and to address concerns and questions. While Chicago Commons strongly encourages everyone to obtain the vaccine who's eligible, we also respect that everyone must make individual decisions about their own health. At Chicago Commons, we want to support you in any way we can. Tonight, we have an exciting panel of public health experts who are doctors from our Black and Brown communities and leading advocates for our older adults to provide you with the most current information to help you make informed decisions. Without further ado, let me introduce our distinguished panel. From the Illinois Department of Public Health, please welcome Deputy Director, Dr. Garth Walker. As Deputy Director, Dr. Walker is a leader in the agency working to protect the health and wellness of all Illinoisans. Dr. Walker is a nationally recognized public health leader and emergency medicine specialist. He's a graduate of several distinguished programs such as the University of Illinois at Urbana-Champaign, University of Illinois at Chicago, Northwestern's Feinberg School of Medicine, and the University of Chicago's Pritzker School of Medicine. The Illinois Department on Aging, please welcome Director Paula Basta. As director, Paula oversees an agency that serves and advocates for more than 2.8 million older Illinoisans and their caregivers. Paula is a lifelong advocate for the care and treatment of senior citizens. Paula received degrees from the University of Dayton and the McCormick Theological Seminary and is an adjunct professor at Loyola University, Chicago. More importantly, today is Paula's birthday. Happy birthday, Paula. Please join me in wishing Paula a very happy birthday and thank you for being here. From the City of Chicago Department of Public Health, please welcome Dr. Geraldine Luna. As Medical Director of COVID-19, Dr. Luna works to improve and promote health for all Chicagoans by providing the latest guidance on COVID-19. Dr. Luna is a nationally recognized leader in health and equity and actively involved in the medical organization for Latino advancement. Dr. Luna is a graduate of distinguished programs at the University of Illinois at Chicago, the Ponce School of Medicine and Health Sciences at the University of Puerto Rico. From AARP, please welcome Illinois State Director Robert Gallo. As director, Bob leads the agency's advocacy efforts in the state of Illinois to empower people 50 plus to choose how they live as they choose. Most recently, Bob's team produced a landmark Disrupt Disparities report documenting the multitude of issues that exist in our adult communities of color. Policy recommendations for talent. Bob is a graduate of Long Island University. And the last but not least, we have Miss Allison Eastling. She's participating in Chicago Commons Adult Day Service. Alice has been with us for more than 6 years. Alice is a great friend of our program, and thanks. Allison agreed to join us to share her experience receiving the COVID-19 vaccine. Let's get started. My first question is for Dr. Walker from the Illinois Department of Public Health. Your team has done a fantastic job addressing this pandemic. Dr. Walker, vaccines have been with us for quite some time. Some have jumped in, vaccinated, others have held back given their concerns about safety. Can you tell us about the vaccine options, how they work, and how do we know that they are safe?
Sure, thank you, Edgar. Just thank you guys for putting this event together. It is truly timely. And what more important time could we have had and chosen to bring all these stakeholders together to talk about such an important topic? But to answer your question about the vaccine, currently we have 3 vaccines, Moderna, Pfizer, and Johnson & Johnson. 2 are mRNA and 1 is viral vector. But the overall goal for all 3 of the vaccines is to do the exact same thing, which is to prepare your immune system to fight against COVID-19. The analogy I like to use is boxing. For example, if you go into a boxing match cold against somebody that has a very unique style, you're either going to get knocked out early, or you're going to not last very long. But if you have a chance to train, if you have a chance to get some exposure, you're going to either last longer or you're going to beat the fight. And that's what these vaccines do. They transcribe a part of the spike protein, which is a part of the virus, and that's what exposes your immune system to be exposed and be prepared. As you know of today, Johnson & Johnson has been put on pause, which is a setback. But the good thing about that is that it means that we are tracking vaccines appropriately. We are making sure that the vaccines are safe, and we're just assuring our populations that the side effects are not as dangerous as what we think they might be. So we're just going to wait and see what the science does. And that's what we've been doing with all the vaccines. All vaccines, these are the most scrutinized vaccines of all time. They've had scientists from all throughout the world evaluating each of these vaccines. They've gone under the same rigor, a randomized controlled trial, which in the science world is the highest level of scientific study that you can apply to any type of intervention, and have been deemed safe by FDA and approved by the EUA. So knowing that, the numbers reflect. When we see our older populations, those who have gotten vaccines, we have seen the number of hospitalizations and the number of deaths due to COVID drastically decline. And that's why we're encouraging everybody to get the vaccine, because not only are we protecting our most sickest, but even if you are not likely to have a high risk outcome due to the virus, you getting vaccinated protects your neighbor and protects your community. It protects your grandmother. So that's why we're encouraging every single person to get the vaccine, so that we can make sure that the virus is under control. Going back to the vaccines, Moderna and Pfizer, they're 2 shots and they have a 95% efficacy. And the reason why they're 2 shots is because that's essentially how they were designed. And after the first shot, they have roughly around a 60 to 80% efficacy. So you need that second shot by the same exact vaccine to be able to achieve that 95%. Johnson & Johnson has roughly around a 80% for severe, but still a valuable tool to use in our kit to help keep people out of the hospital and keep deaths from rising. And lastly, when we think about the vaccines, think of it as 3 steps in which they protect you. One is that they reduce your likelihood of getting the virus. The second one, they reduce your viral load inside, so it reduces your chance of spreading that virus to somebody else. And third, say you're very sick, say you are an elderly person with end-stage renal disease. We see those patients have a 10 times more likelihood of dying from COVID. If you get the vaccine, instead of being admitted to the hospital, maybe you just might have some fevers and chills. And if you're healthier, maybe you might not even notice it. So it really brings multiple benefits. And I'll stop there so we can continue with the conversation unless there's more questions.
Dr. Walker, one follow-up question. Briefly, can you talk a little bit about possible side effects for the vaccine?
Sure. So some of the most common side effects that we see are sore arm, as well as fevers, chills, body aches, essentially as if your body's fighting a virus currently. I got the vaccine on my second shot the next day. I had fevers and chills. I was in bed drinking orange juice, making sure I took it easy. But the following day, I completely recovered and I was back to my day-to-day activities. So you should expect that you might have a reaction on either of the shots.
Great, excellent. Thank you, Dr. Walker. Next, I would like to ask a question of Director Paula Basta from the Illinois Department of Aging. Thank you again, Dr. Basta, for joining us tonight and for your investment in leadership to organizations like Chicago Commons and throughout the state. I know you'll only be with us for the first half of the program. So Director Basta, could you share with us how older adults outside of the Chicagoland area can go about getting vaccinated, and what are the resources the Illinois Department of Aging have to support them with COVID-19 vaccines?
Absolutely. And good evening, everyone. Thank you so much, Edgar. And thanks for that birthday shout out. I appreciate that greatly. That was so terrific. And to your wonderful Chicago Commons team, let me again by saying thank you to them and everyone also who's on the town hall. But the Chicago Commons team is doing an amazing job, and the sacrifices they've made this past year to continue to serve our older adults, our most vulnerable older adults, has been terrific. And we appreciate you greatly. So thank you to all of you and to your team and to your staff. It seems like it's been a year now, 13 months almost. It feels like it's been longer, but I want you to know that our older Illinoisans have shaped our state's rich history. And because of that, it's our obligation to ensure that they have the services and the supports that they need to depend on, that they can live healthy lives. And so our primary concern at the Illinois Department on Aging has been and always has been and is now to let them know that they're not alone, that they don't have to go through this by themselves. Our goal has been since the beginning of the pandemic, to limit the exposure to the virus in older adults while increasing the ability to closely monitor their well-being. We've taken our guidance many times from our sister agency, the Illinois Department on Aging, making sure we had processes in place, screening tools, making sure that if in fact they were getting in-home services, that they were doing so, getting those services very safely. For example, to even our home delivered meals program, which has been incredibly utilized because we had to close all of our senior centers, and our congregate dining sites have been incredible. We're doing to the tune of 48,000 home delivered meals a day in the state of Illinois, so that making sure that food insecurity would not be an issue for our older adults. So I want to make sure that people know that. Unfortunately, though, the statistic still remains the truth that 88% of all the COVID deaths have been for older adults, 60 years of age and older. And for some of us, I know this has meant even some of our loved ones have perished. So we also are grieving in many ways with you. We want to make sure you know that we as an aging network continue to persevere. We're doing all we can to make sure that you have what you need in order to get the best education around COVID. I'm so grateful that Dr. Walker was here and that all the doctors are here with us tonight, because they are the scientists and we listen to everything they tell us. And so we're so grateful that they're here to talk to us. But we need to make sure that we're talking to especially our diverse populations of older adults. As you said earlier, Edgar, our brown and Black communities. Those are our communities that we want to make sure we're getting the word out to and that we're assisting in many ways. So how are we doing that as an aging network? Well, we're doing that in several ways. I want to say right now, though, as of today, I've heard that the statistic is 75% of older adults, 65 years of age in Illinois, have now received the vaccine. So pat ourselves, clap, make sure that we know that we're on the right path. I want to make sure that maybe the next time we all meet, maybe not even virtually or maybe virtually, it'll be 100% that we can say that all of our older adults have been vaccinated. But it's imperative that we listen to the voices of those who may be a little questioning, skeptical. We want to make sure we answer all of your concerns. So to that end, we have the Aging Network consists of 13 area agencies on aging, what we call our AAAs, and they are doing amazing outreach to all of our seniors. And this, for example, in the city of Chicago, you have the Department of Family and Support Services, who is our AAA. And throughout the state, we have other 12 area agencies on aging who are doing great outreaches. They have been sponsoring vaccine clinics at churches, at senior centers. Since they're closed, they can open for those things. Park district buildings. They've been able to make sure that they are doing outreaches to all the faith-based communities so that we know that all of the trusted voices that older adults listen to are going to be telling them the same thing. But we want to make sure they have the right education. And so to that end, we're also taking all of the brochures, all of the information, making sure we're making phone calls. Our care coordination units, our CCUs, there are over 46 of them throughout the state, are calling our seniors who are living by themselves. Those are the ones we worry about most, the ones who have no one. Those are the isolated ones, the seniors who really need our outreach. And so we're doing everything we can to make sure that they have what they need. If they would like to get a vaccine, how can we sign them up? We do that online if they're not able to do it themselves. If they need to call, we have those phone numbers. I actually can give that to you right now. And then also, we want to make sure that they need transportation, that we will provide transportation. The Department on Aging has found $1 million to give to the AAAs right now just for outreach, for vaccine outreach, for vaccine education. So I hope that you know that we are doing all we can, especially in our minority and rural communities, because Illinois as a state has the rural areas as well. So there's a couple of things besides our CCUs and our AAAs that we have out there that can be helpful. For seniors who are listening to our town hall tonight, I'm going to give you our 1-800 number to give us a call if we can get you some help to connect with depending where you live, what area agency on aging you can reach out to. And that number is 1-800-252-8966. That's 1-800-252-8966. I also want to make sure that I give a shout out to the Illinois Department of Public Health and their hotline, which is the Vaccine Appointment Call Center phone number. And that number is 1-833-621-1284. That's 1-833-621-1284. I want you to know that we're here for you to help you any way we can. Most importantly is to connect you when you're ready to get that shot, to connect you to get that shot and make sure that you stay healthy and well, however however we can help you do that every single day. So we also are doing virtual classes. I know Chicago Commons has been embracing the virtual world with your adult day centers and just doing amazing things that people have done to do the work in so many ways we've never been asked to do this way before. So we've seen creativity, new partnerships, innovative ideas, and I'm just so grateful that we're part of this aging network. And it's been my honor to be with all of you tonight. I also want you to know that there is over 900 vaccination centers going on throughout the state of Illinois, over 900. And again, if you know or would like to have the website of where those locations are, maybe we can put this in the chat. It's https://coronavirus.illinois.gov. And I think that you want to make sure that people have that to reach out to whatever way you can to get information. It's phone calls, websites, however we can get you the information to get you that vaccine, that appointment to get a vaccine. We want to be there for you. I'm going to stop there. I'm going to see how I can answer more questions. And thanks again for your time.
Thank you, Director Basta. We're so grateful for your leadership and sharing your information with us tonight. Next up, I would like to ask a question of Dr. Geraldine Luna from the Chicago Department of Public Health. And Chicago Department of Public Health has done an excellent job in helping us navigate this pandemic. Thank you again for your leadership, Dr. Luna. Dr. Luna, can you tell us a little bit more about how vaccines are currently getting distributed in the city of Chicago and the surrounding suburbs? Also, how can folks on the call sign up for a vaccine?
Of
Is there any
course, and
transportation?
transportation. Okay, of course. Thank you. First of all, I want to thank again Chicago Commons for hosting this amazing event. It is so important that we work on our senior population and informing them and having all those resources available. Since you're right, I agree. Our seniors are the most vulnerable population that we have, and they're at 10 times at risk of any other group of getting COVID and dying from it. So the city has made an incredible effort to reaching out to our communities. We're working. We even have a task force or a committee. I'm sorry, addressing the issues of our 65 years and older, of our older population, working with a couple of the people in this call and the agencies that serve them. And we're very grateful for those partnerships. And this last past month, completely, it was senior month, completely dedicated to it. And we know that they were 1B and they continue to be 1B. The priority is very high. And also the seniors that we had in 1A, which are those living in long-term care and nursing home facilities, which gratefully we are from partners pharmacies that they have been very outstanding in vaccinating that population. And now this past month, I'm sorry, we were vaccinating our seniors. We did events. United Center continues to give priority to 65 years and older. And for those individuals that haven't received the vaccine, anybody that lives in Chicago is in that list. The only thing they have to do is reach out to 312-746-4835. And we have a COVID hotline dedicated to address. It was created for our senior population because we know that there is a digital divide and not everybody can navigate the system, electronic systems and internet the right way. So we wanted to make it available to our seniors. And this is United Center. But at the same time, for these seniors that we have, very frail seniors living at home, those that are homebound, we just launched last month again the senior homebound program. And right now we have like 4,761 individuals registered. We were giving Johnson & Johnson to this program because of the feasibility, practicability of one dose and moving on. But now, I don't know if you guys know, but Johnson & Johnson is no longer an option until we kind of go down and revise a couple of 6 cases that were reported having clots in young women. And from 7 million of individuals receiving the vaccine, we hope for a positive outcome and then resume the vaccine only if it's safe. But in the meanwhile, we're doing strategies now, strategizing and continuing to provide the homebound program to individuals. We do 27 up to 36, 47 we did in one occasion, visits per day, vaccinating the seniors in their homes and their caregiver as well. We also have, as I mentioned, these massive site United Center, which gives priority. And let me just give you the neighborhoods that are prioritized by the United Center and all our massive centers right now, because we're giving priority to all those seniors 65 and older in Chicago, regardless of where they're living. But also we have programs specifically for those seniors from those communities highly hit in Chicago, which are African American and Latinx communities. So I want to share that information that I have for those individuals to get vaccinated as soon as possible. For if anybody, if any senior that is listening to this call or any of our facilities providing care to our seniors, live in the communities highly protected or Protect Chicago Plus, we have West Englewood, New City, Gage Park, North Lawndale, South Lawndale, Chicago Long, Englewood, Roseland, Archer Heights, Washington Heights, Austin, Montclair, South Deering, Belmont Cragen, and Humboldt Park. Those are the 15 plus based on a vulnerability index. And we know these populations, these communities are been the most highly hit, and others. It's not only those one. We have identified like needing immediate action, 26 communities altogether and more, based on vulnerability. We know that the necessity is very high on our population. And this vulnerability index, for those of you like, Doctor, how did you choose and pick these community from others? Because I do have seniors living in my communities, but these communities were based on higher hit. They were taking into account socioeconomic status, household composition and disability, minority status and language, housing type and transportation, and epidemiologic factor, which means a high degree of chronic diseases within the population, and health system factors like capacity for preparedness, plans in action. If they were living in a desert, and we're talking about healthcare deserts without quality care, without accessibility to good transportation, all those were reflected in what is statistics, higher mortality, higher rate of hospitalizations dying from it. And those were the actions that we're taking. This vulnerability index included also science implementation and equity. That was the way that we went over to decipher those communities more highly hit, morbidity, mortality the highest, and in putting into account a potential benefit versus risk of vaccinating, or in also implementation, feasibility of going there, getting seeing the acceptance of the vaccine by the population if we were facing some type of resistance, some type of all that lack of information that was taking into account, and hesitancy. And then the equity part, which is so important. If we were advancing equity principles, also those were included. If the benefits, if we were maximizing benefits and minimizing the damages, or promoting social justice, or mitigating inequalities. So all those things were taken into account. And to these communities and others that I'm going to mention too, that we follow as well, we have right now our clinic sites in those places, events, they're coordinated with community-based organizer. We have the churches. Right now, this is a month of Faith Month in Chicago, and we're doing a lot of events in these places with our leaders of faith. And we also have our pharmacies, our healthcare systems, which are very known faces, trusted faces in the community, because we know that it's part of the hesitancy, and most patients don't feel comfortable. Also, those communities where our seniors live, they're undocumented individuals, or they lack insurances to go to healthcare systems and receive quality care at all. And then our other population, very protected, very vulnerable, is our undocumented, as I mentioned, and our refugees also. So we have all these activities happening. We have these organizations that are this group that are following under Protect Chicago Plus, in our clinic site in place. Also, we have launched what we call it our bus, our vaccinating bus. Is like a CTA's bus, but it has been adapted to go to these places, to those communities more highly hit, make sure there is no barriers to accessibility to getting the vaccine. And we're making sure in this, for example, in this communities that are not immediately those 15 plus, but they are highly impacted as well, like 60608, 60619, 60620, 60624, 60644, 60648, 60651, 60652, 60653 also have been included in these massive events that we're doing, getting there, working with community. We're working with organizations within the community that do home visits, as well as the one that we have our own program, a Homebound program. We also, this past month, we vaccinated the following other communities, which I'm sure these are hyper local approaches to make sure that all the people in that place get vaccinated in a logical way. If we were to vaccinate the whole zip code, it would made it impossible, especially at the very beginning, that we had this logistic problem with limited vaccinations coming into the city. But hyper local, we were hitting those places that were the highest affected, the mortality the highest. And we were getting a lot of the spread of the disease in these places. And by doing hyperlocal approaches, it was a more feasible way to cover in logistics and to bring down mortality and contain the spread of COVID-19. We're also talking about Arbonne, Gresham, Burnside, Calumet Heights, East and West Garfield Park, Fuller Park, Grand Boulevard, Garfield Ridge, Hermosa, Lower West Side Pilsen, South Shore, Western Lawn, and West Pullman. All those are included in receiving events, going to churches, libraries, bringing them to places they feel safe, with people that they know surrounding them, with those trusted faces, with those trusted voices in the community, and where hesitancy decreases significantly. Otherwise, they wouldn't have the same fighting chance of getting this life-saving vaccine if not provided with these resources. And when we're talking about our Homebound program that I mentioned, that 4,700 individuals have been already registered, and now that we're moving to other logistics in terms of vaccination, they can call again our hotline, and I'm going to mention it over and over because we have created this hotline particularly for our senior population that for them is very difficult to navigate systems. So we're talking about 312-746-4835. Again, 312-746-4835, and you'll get connected to a real person, to somebody there in your own language. If you don't speak English, if you speak Spanish, they will, a Spanish individual will come to the line and help you make those appointments, because that's what we're doing. When we go to these communities that I mentioned, we vaccinate everyone, not only the patient or the senior itself and the caregiver. We vaccinate everybody in those homes, because it's important if we want to save the life of these individuals living in these places. We vaccinate everyone. The mortality is higher. The spread of the COVID comes into your home. We're talking about overcrowded houses. There is no way we can vaccinate one individual and have not others get vaccinated and have them all safely living in the same place. And the hesitancy is so high, and this so highly hit communities that in order to bring down the COVID-19 spread and the death and the devastation secondary to getting COVID-19 was vaccinated everyone without prioritization lists. We also want to mention that another important program that we're working with right now. Oh, okay. So just in case we have caregivers or people that can also navigate the system in order to understand where we're at. Right now we're in 1C, but we're moving very quickly to vaccinating the general public. And we want all those individuals that come in and out of our senior homes to be vaccinated, grandchildren, everyone. They're 18, and in this case, 16 years and older. You can get also a lot of information in www.chicago.gov/COVIDvax. So you can get the forms if you want to register anybody to become a homebound individual getting the vaccines at home. If if you're thinking of if you need to access or see where you're at standing in terms of prioritization lists, and remember that April 19 we open to everyone. This is a great place to get it. Sites that you can get the vaccine, and also there is an application for those individual caregivers that are savvy navigating the systems, and also seniors that we have that they do know how to navigate the systems electronically. They're very good and well versed at it. So you can download the application socdoc.com/vaccine. Also, you can get your appointment there. It's only 1 minute to get an appointment in this application, so that our seniors are well prepped and no one stays behind. That's our equity approach to Chicago, especially to those that need it the most, and we want no one to be left behind.
Thank you, Dr. Luna, for your leadership and for your insights with us tonight. I want to change it up a little bit tonight and ask a question to Alice Eastling from our Adult Day Service Program. Ms. Eastling, thanks for joining us tonight.
Thank you.
Yeah, I understand you received your COVID-19 vaccine. Can you tell us about why you decided to get it? And also, what was your experience like?
The reason why I decided to get it because I had family members that was dying have died of the COVID vaccine, and they was my loved ones. I loved them and whatever, but then I was saying to myself, now I need to get this shot in order to save me, because the family members, they didn't get a shot and they died on me. And then I want to be around I want to live. I want to be in the world, to be around my grandchildren and my children. And I seen the how the death of so many people have died from Black and brown communities and whatever. And I live in a Black and brown community. So I want to shield myself and take the virus, take the shot, because I want to shield myself from others who might have it, that may can give it to me. So that's why I made the decision that I need to get the shot to save me and to be around other people and kind of keep me from getting COVID from other people. So that's why I decided to get the shot. And for a minute, I decided that I might not want to get the shot. I was pulling both ways, you know, should I get it, should I not get it? But then I weighed my option and I said, well, you know, if I want to be here with my children and I want to live and I want to keep doing things in my life without getting sick in the bed and can't do anything, because I do have underlying conditions. I have COPD, I have high blood pressure, I'm a diabetic. So I know I needed to get those shots because of respiratory wise anyway. So I can keep breathing and keep on moving. So that's why I decided to get the shot. That was one of my reasons. My experience with the shot was that I went to call my doctor's office, and I went to my doctor's office. They explained everything to me, detail by detail, what would happen, the side effects and everything. So I understood that or whatever. So I made the appointment. They gave me a ride, picked me up. Someone picked me up and took me to the site. I did I had to sign papers and whatever, fill out papers and whatever about my background, my health background. You have to do that. But in my experience, when I went in there and into the room and they gave me the shot, my arm was painful. It was painful, kind of painful, almost like a flu shot or whatever. But then my arm, it swelled a little bit, but it was okay. Okay, I was fine that day. I had no problems the rest of the day. I felt good, no fevers, no chills, no nothing. Okay, the next time, weeks went past, and I had the second one, because you have to have both shots. You can't go with one and not the other. So I went to have my second shot, and when I had my second shot, they explained to me everything that was going to happen and whatever. So I had the second shot. And the second shot was a little bit painful than the first shot I had. So you had to sit down there after you got the shot, sit down, and they have to watch you for a minute to see if you have any side effects or anything may go on with you there. So I was fine, came on home or whatever. I had no side effects that day. That day I was fine. She said, move your arms and take Tylenols. That's what you do. So that's what I did. But the next day, I went to my daycare center, Chicago Common Daycare Center. When I got home, I was feeling some type of way. I got home about 4 and I was feeling some type of way. I felt feverish. I felt tired. I felt chills. I felt headaches. I felt all those things. So immediately I went to bed. I'll say, this sounds like I'm trying to get the flu or something or whatever, So that was my side effects with that. So what I did, I took the Tylenols. I drank plenty of water and whatever. Soon, I dozed off and went to sleep. Hours later, I woke up. I was feeling fine. Didn't have no chills, no fever. I wasn't tired anymore. I didn't have a headache. I was fine after all that. So I said to everybody, everybody should get a COVID shot if they want to be around their loved ones. They think that you want people to come around you. You want to live longer or whatever, because you get so many. People said people don't want to get the shot because of different things that they have heard or whatever. But way I see different things happen to different people. Everybody don't get sick off the shots. Everybody don't get headaches or fever or chills or headaches and whatever. It's just some people do. And I advise all the seniors in the Chicago area to go get their COVID-19 shot to save them and to save your loved ones, because you probably would give your loved one the virus and you don't want that. So I advise everybody 65 and older, the elderly, the young people, everybody to go out and get that COVID-19 shot, because we need it. we need it very bad. And that's why I decided to go get the shot. And that's why I decided because of the people around me that had died around me, cousins, and all those people have died around me. So that's why I decided to get the shot. And that's why I'm well now, and I'm well, and we're back into the center, and we're six feet apart, and we're wearing our masks, and we're loving every bit of going back into the center. Thank you, everyone, for listening to me and hear the reason why I decided to go get my shot and the side effects that I had. And I'm still here, and I'm well.
That's right.
Thank you very much.
That's incredible. Thank you, Alice. And we're so happy to have you in our center. You're one of our
Thank you.
Participants. And thank you for your leadership with being with here to us tonight, and for all your wisdom that you have imparted with us tonight. Our mission at Chicago Commons is to empower individuals, embrace opportunities. You truly embody this mission in action, Alice. Thank you. I would like to ask a question to our last panelist tonight, Mr. Bob Gallo from AARP. Bob, before I get started, I want to acknowledge the important role you and AARP play, folks like Alice and Caregivers for older adults. You know, Chicago Commons is proud to be part of your important Caregivers mural project, highlighting older adults and caregivers who have been true heroes throughout this pandemic. A couple of our Chicago Commons colleagues are part of this project, the Basta installation. Bob, as more and more people get vaccinated, people are wondering what this means for how we live, how we travel, meeting indoors with loved ones, etc. Can you share with us what AARP is advising people to do once they have been vaccinated, and what resources you have available to help keep these people informed?
Yeah, thank you, Edgar, and everyone at Chicago Commons, and a special thank you to Alice, being a true hero and telling her story. And I'm very sorry, Alice, for the losses of your loved ones, and I hope that you speaking out will encourage others to do what you've done. We're over a year into this pandemic in this country that's affected everyone. And we were involved very early on because we realized that people who are older are much more susceptible to a lot of things. Even getting the flu. That's why we get a flu shot every year. I got a flu shot. I've gotten both of my COVID shots as well, and because I knew what that type of protection would bring. But there are things that folks need to keep in mind right now, and as they've heard from the experts, they've heard from folks who have a medical background of what the different shots are all about. They heard from the director, Paula Bosta, and others about the availability of where you can get a vaccine. But the most important part is to act and to also consult your own doctors about their advice for you too. 95% of those who have died in the United States have been over the age of 50 when it comes to COVID-19 virus. So that tells you something right there of why this work is so important that everyone here is doing and getting the word out, to make sure that you do the right thing. You've socially distanced, you've made the sacrifices up until this point of not being at the graduations or the birthday parties or the weddings or the holidays because of your own safety and the safety of others. But now it's time to think about yourself too, because we both want to return to something that felt like it used to be normal. I've not seen my brothers and sisters or my wife's brothers and sisters or our nieces and nephews for over a year now, and that takes an effect on us. And that's why I got the shot. But you also need to keep in mind that the pandemic is not over. Even if you do get your vaccine, or when you do get your vaccine, if you're going to go out in public, is to wear that mask. It's still important that even if you could possibly still be a carrier of the virus and you don't want to give it to somebody else, or you don't want to get it from someone who does have it, if you're in a weakened state. So, the information that we have is readily available and goes to a lot of sources. And those of you who have internet access can go to aarp.org, and right on the landing page, there'll be up-to-date information, even about the Johnson & Johnson vaccine and the pause that's been recommended right now, and until we get a better idea of whether that should proceed or not. But I also read that the state is filling that gap in with the other vaccines and sending those to the Chicago and the Chicago area so that we don't have to miss a beat here. The other thing folks really need to pay attention to, there are nefarious people out there who always try to take advantage with various fraud and scams. And, when I first got my driver's license a long time ago, I was so excited that I showed it to everyone. Don't do that with your vaccine card, particularly now with social media. You don't want to be showing that on Facebook to your friends because that information can obviously be counterfeited and duplicated and used for nefarious reasons. Just the other day, I got a text on my cell phone. Hey, there's plenty of vaccines on the north side, and anyone can get one. I have no idea who that came from. I have no idea who that came from. And I wasn't going to respond to it because they were going to ask me another question. There are sweepstakes out there going on that if you fill in a survey about your information and your vaccine experience, you might win an iPad. Don't fall for it. You really do need to protect yourself. So even the latest frauds and scams that have been going on for a long time, they've evolved those to the current news, particularly because we're concerned, we're confused, and many of us are frightened and trying to figure out what we should do. That's always an opportunity for the bad guys out there to try to take advantage of us. Going back to communities where disparities have been shown, particularly in Black and Brown communities, this isn't something new. COVID has shined a brighter light on the health disparities that have existed in Black and Brown communities for decades now. And even in nursing homes in those communities, the death rates have been so much higher than in nursing homes where other precautions were taken from the beginning. So, we commissioned a survey with Loyola University, to help us identify all the bodies of research and data that are out there right now to find out what really are the issues going on in communities where these problems, economic, financial, health, have gone on for decades and decades, and where do we need to fill in the gap with information now in order to urge policymakers to direct resources and revenue and services to those areas where they are needed more than other areas. So that's sort of the work that we've been doing right now. We have 1.7 million AARP members, and I can tell you that they have called us with so many different questions that have been answered already about where to get the vaccine. Is it safe? My father is homebound and I can't take him somewhere else. We've done forums like this with the governor and the head of the Illinois Department of Public Health, where they can ask direct questions to experts, medical personnel, and scientists and policymakers, because there still is a lot of concern out there, and these forums do a great job in clearing that up. I'll conclude with that, and if there's any follow-up questions, happy to answer those, but I'm sure there are some other questions from folks who are listening this evening.
Thank you so much, Mr. Gallo. And the important role AARP plays as an advocate for our older adult and caregiver communities. Before we wrap up tonight's program, I have a few questions for our panelists from folks who've RSVP'd for the program. Given the time constraints, I think I'm going to ask two of the questions from the list. Question one, and this is for anybody on the panel: which vaccine is better for seniors?
Did that. Whichever one is available is the short answer. Generally speaking, whichever hospital or clinic that you go to, you won't really have the choice. Operationally, we've seen some advantage for Johnson & Johnson because it's a one shot, and that's typically for populations that are hard to follow up with, but as we know, it's on pause for now to make sure that it is safe. But if you have access to a vaccine, just take the vaccine that's available to you. Between Moderna and Pfizer, the efficacy is the same, as well as the weight.
If you take medication for blood pressure, diabetes, or other health conditions, should you get vaccinated? Anyone on the panel?
Or the contrary, if you have blood pressure or diabetes, any underlying conditions that put you at higher risk of getting COVID and suffering from the very poor outcomes of it, like, dying from it, for example, those individuals are the ones that we highly recommend that they get vaccinated. And we're talking about 65 years and older, which was 1B, or if they're younger than 65, we're talking about 1C, highly prioritized in getting these individuals vaccinated.
Excellent. I actually want to ask one more question from our caregiver group. As a caregiver asked, if I am pregnant or planning to get pregnant, should I get the vaccine?
Well, I can give the recommendations of CDPH, but if any other of our panelists here would add, more than happy. It's even though that there were not much representation of pregnant women or lactating women in our clinical trials for Pfizer, for Moderna, or Johnson & Johnson, CDC still recommends pregnant women to get vaccinated. CDPH always recommends that any pregnant woman or lactating mother go in and have these conversations with their pediatrician or the OB-GYN if they're pregnant about getting the vaccine, just to err on the safe side so they can feel comfortable getting the vaccine when it's time.
I could add to as well that the American College of Obstetrics and Gynecology recommends that it is not withheld from anybody. They think that the risk associated with actually getting COVID compared to the risk with getting the vaccine is higher. So in general, they recommend you should get the vaccine, as well as have that conversation with your doctor. Because as we know, it's best to get the best information from somebody that can give you an informed decision. And your OB/GYN typically has the best handle on your overall health profile.
Excellent. And it looks like we're at time. I want to give a special thank you to Julio, Basta, and Brittany from our development team for making tonight happen. Thank you to all our panelists joining us tonight. Thank you for everyone on the call and the Zoom for joining us tonight. As we move along and we'll receive more information, we'll be a glad distributor of public health information for all our participants in the general senior community. Really want to thank everyone again. Good night and be safe.
Thank you.